The Colchester Sexual Assault Centre is thrilled to welcome our first special guest presenter, who is Dr. Tammy Bernaski. She has been working in the disability field for more than 20 years and has lifelong experience of disability. She specializes in addressing gender-based violence in the disability community, and her research explores individual and collective processes of empowerment for women and trans people working to end gender and disability-based violence. Tammy is committed to creating space for people with disabilities to share their stories and experiences through her work, which most recently she became the assistant professor at Cape Breton University and as a published author on the topic as well. So I actually have a copy of Tammy's book here. So it is Working to End Gender-Based Violence in the Disability Community. So I encourage you all, after hearing the presentation today, to get yourself a copy. And we also do have it available in our Community Resource Center as well. Now I will throw it over to Dr. Tammy Bernaski.
Thank you, Jamie, and thank you for that introduction. So thank you very much for the invitation to talk, to be a part of this speaker series on the impacts of trauma and sexual violence on marginalized groups. As Jamie said in the introduction, I'll be speaking about the disability perspectives. I do specialize in disability rights, disability advocacy and inclusion, and I also have lifelong experience of disability as well. I also have personal and professional experience in working around gender-based violence and disability and sexual violence. Today, I'm going to talk a little bit about disability, and I'm going to talk a bit about the statistics around violence, sexual violence, and disability in Canada. My work is international in some ways, but I also do focus on the situation here in Canada as well. So I'll start by talking a little bit about disability, and I'll also start by saying that I don't often like to clearly or strictly define disability because it's an evolving concept. So the United Nations Convention on the Rights of Persons with Disability does not directly define disability in the definition section. Rather, it does treat it as an evolving concept, saying that disability results from the interaction between persons with impairment and attitudinal and environmental barriers that hinder their full and effective participation in society on an equal basis with others. So impairments can mean a lot of things for a lot of people, and often when I'm working with people with disabilities, I leave it to them to self-identify as to whether or not they have a disability. Disability can take many forms, including physical, intellectual, learning disabilities, neurodivergent, sensory disabilities. There's the deaf community. There's all kinds of different ways that disability can be experienced. And also, I think importantly, in talking a bit about disability, we often want to talk about how impairment interacts with various barriers, not just what we think of in terms of environmental barriers, but also attitudes and behaviors, and I would also say structural barriers. A lot of my work is around structural violence, so looking at the way that different systems work together to impact people with disabilities disproportionately. In terms of rates of disability, this is an interesting conceptualization as well, because globally speaking, about 1 in 6 or 1.3 billion people live with a disability. This is a recent statistic. The first time a statistic was ever published, I guess, was with the World Report in 2011, where it was noted that 15% of the world's population had a disability, or about 1 billion people. I would argue that the rates of disability globally cannot adequately be defined because there are all kinds of different ways that disability is understood across contexts. And also there's barriers and challenges around reporting disability. Some people don't want to identify Sometimes people are hidden in their homes. There's all kinds of different reasons why the numbers might not be adequately reflected. But for the purposes of today's presentation, I will say that 1 in 6 people globally have a disability. In Canada, it's about 1 in 5, and in Nova Scotia, it's about 1 in 3. So about 1 in 3 Nova Scotians has a disability, which it makes it a little bit higher than the national average. You'll see that I have footnotes here, and you can see the references at the end. So according to a Statistics Canada survey in 2014, 40% of Canadians with disabilities reported being physically or sexually abused as a child. I will say that most of my work is around working with or looking at and researching the experiences of women with disabilities. There's less known about trans people and not a lot around men with disabilities as well in terms of sexual violence. What I did note from the survey is that men with disabilities were more than twice as likely to experience sexual abuse as a child than men without a disability. And also 88% of those impacted by sexual violence with a disability were women. So we can see that there are higher rates of violence and sexual violence among people with disabilities than those without. Women with disabilities are also twice as likely to be sexually assaulted as those without disabilities. 25% of women labeled with intellectual disabilities and 26% of those with a mental health disability were noted in this survey to have been sexually abused before the age of 15. Among those impacted by spousal violence, women with disabilities were more likely to fear for their lives than those without disabilities, and also more likely to fear for their lives than men with disabilities. And so there's a lot of information here that really identifies the disproportional ways in which people with disabilities are impacted by sexual violence. So interestingly, when I was doing my own research, I would tell people that I was researching gender-based violence and disability, and overwhelmingly, the response I got from people was, is that even a thing, is what people would say, is that even an issue that needs to be addressed? And I instantly would say, of course it is. The rates of violence are actually higher in the disability community. And also there's different kinds of violence that people with disabilities experience. And I'll talk a little bit about that today. I'm going to say a little bit here about my own research, because some of my research is going to be referenced throughout this presentation. I interviewed 13 advocates in 9 different countries. So in Australia, Bangladesh, Canada, Ghana, India, Kenya, Nepal, the United States, and Yemen. Some of the interviews I did in person, other interviews I did either through email or through video or phone. I'm really interested in understanding why people do what they do in terms of advocacy. So I was really looking at what are the motivations for doing advocacy around disability and gender-based violence. And then I wanted to know what were the challenges and successes of doing this work. We know that there's a lot of challenges, and I wanted to know what kept people going in the work that they were doing. So in terms of risk for women with disabilities, because this is overwhelmingly where the data exists right now, although there is more work being done on other groups as well. Women with disabilities live on lower levels of income and are more likely to experience violence and abuse. There's a heightened risk of violence due to increased dependency, and this can mean a lot of different things. So dependency could mean that there's more of a dependence on caregivers or family members. There might be more economic dependency, that sort of thing. There's a lack of affordable housing or income supports for affordable housing, which force women into cycles of poverty and continued dependence on abusive partners. There's also a perception. So one of the risks is that there's a perceived vulnerability of women with disabilities. So they're perceived of as more vulnerable, and in some cases they are actually more vulnerable as well, and so this contributes to risk. In terms of types of violence, I know this presentation is focusing on sexual violence, but there's all kinds of other forms of abuse that can take place in conjunction with sexual violence or as a part of sexual violence. For people with disabilities who have caregivers, for example, there might be a withholding of care or withholding of medical devices or medication. So perhaps a person needs to be transferred and the care person will refuse to transfer that person. There could be intentional isolation, so leaving people alone for long periods of time or using restraints unnecessarily. And I would argue that they're always unnecessary. Also, violations of privacy. So a lot of times if people are dependent on other people for care, there's an expectation of trust there. And so sometimes violence can take the form of violating a person's privacy. Being left in uncomfortable or embarrassing situations can also be a form of abuse. Denying reproductive rights. This is a really big area of studies. Certainly historically, there's a long history of sterilization of people with disabilities in Canada, particularly if people were institutionalized. And then as a part of that institutionalization process, a lot of people have been sterilized. And I'll just say that even in my own research, I interviewed a woman, this was in Australia, and she talked about, she did various kinds of roles in the disability sector. But one time she got a phone call from a family, a set of parents who had a young child, a young daughter with a disability. And sometimes they would put her in a respite center for a day or a small amount of time so that they could have rest. And so they went to see the person that I was interviewing because they were concerned that their daughter might be in a situation where she's being sexually abused or experience sexual violence. And so they were meeting with the participant that I was interviewing to ask about the possibility of sterilizing their daughter because they didn't want her to become pregnant. And I remember feeling alarmed in that moment. The participant said, the parents they weren't speaking from a place of like harm. They actually believed that the safest thing that they could do was to try to sterilize their daughters in order to avoid unwanted pregnancy, instead of trying to address the fact that there might be abuse happening in the respite center in the first place. And so this is just one story. I mean, there's also other people who were unknowingly sterilized while they were institutionalized, and then later when they tried to have children, they realized what had happened. There's also a denial of parenting. So there's these, in terms of attitudinal barriers, a lot of times there can be this perception that people with disabilities can't be parents. And so there might be things like forced abortion, or a child might be taken away from the parents because there's this perceived notion that a person who has a disability cannot adequately parent a child. Again, forced institutionalization and psychiatric interventions. Because the psychiatric interventions can be a little bit more difficult to see, I guess, because often they're not illegal, right? They're state, they're imposed by the state or by the institution that is. Psychiatric interventions are often made in the guise of care. Even again, in my own research, I interviewed a woman in Canada who had reported being sexually assaulted and then was forcibly institutionalized because of that. And so there's a lot of times where people are restrained and other kinds of interventions are used that can be violent and abusive towards people with disabilities.